Acute diarrhea in adults treatment. Rehydration therapy, ideally oral rehydration therapy, recommended as first step for treating acute diarrhea. After dehydration is addressed, continue feeding or resume feeding as soon as possible. Conduct clinical exam to characterize symptoms and determine severity, assist etiological investigation if necessary, and assess need for diagnostic testing and additional therapy. Antimotility or antiperistaltic agents may reduce stool volume and frequency but are contraindicated if bloody stool, fever, or abdominal pain are present due to concern about prolonging duration of inflammatory diarrhea. Loperamide Imodium monotherapy, initial dose 4 mg, with additional doses 2 mg after each unformed stool up to maximum 8 mg per day for 2 days. Appears more effective than bismuth subsalicylate for reducing symptoms. Loperamide-simethicone combination, Imodium multi-symptom relief, such as chewable tablet containing loperamide 2 mg plus simethicone 125 mg. Recommended over monotherapy for faster and more complete relief of acute nonspecific diarrhea and gas-related discomfort. Resuscidotril, Hydrosec, Tiorfan, may reduce acute diarrhea in adults by about 1 day or about 1 unformed stool per day. Appears as effective as loperamide and associated with lower rate of reactive constipation and abdominal distension. For patients with bloody stool, fever, or other contraindications to loperamide, consider bismuth subsalicylate, such as Pepto-Bismol, but be aware of contraindications including concurrent use of anticoagulants or other medications, pregnancy, advanced HIV infection, and other factors. For patients with HIV infection, consider crofelemer, Folizic, a chloride channel blocker. Antimicrobial medications. Antibiotic treatment for community-acquired diarrhea should generally be discouraged as most community-acquired diarrhea is viral in origin, norovirus, rotavirus, and adenovirus. Routine use not recommended, as inappropriate use may lead to antimicrobial resistance, prolonged duration, such as with Clostridioides, Clostridium difficile superinfection, prolonged carrier state, such as with Salmonella infection, induction of disease-producing phage by antibiotics, such as Shiga toxin phage induced by quinolone antibiotics, harmful eradication of normal flora. Consider antimicrobial therapy if symptoms severe, such as passage 6 stools daily or duration without improvement greater than 72 hours, or do not improve after rehydration therapy or antidiarrheal medication, and bacterial or parasitic pathogens strongly suspected such as with fever or bloody stool, especially if history and symptoms raise suspicion of systemic infection, suspected hospital-associated or antibiotic therapy-associated diarrhea, suspected traveler's diarrhea characterized by 3 loose stools over 24-hour period shortly after or during travel, consider quinolone. Consider specific medications for specific infections. Probiotics. Probiotics may reduce duration of acute diarrhea in adults. Most evidence based on trials with children. Specific strains associated with reduced duration include Lactobacillus casei strain GG, Enterococcus lab SF68, and Saccharomyces boulardii. Low doses 10,000 million organisms daily, but not high doses greater than 10,000 million organisms associated with reduced duration. Effects are specific to strain and should be verified in adult human studies. Extrapolation of effects between similar strains not possible. Wish you good health, creative inspiration, of your professional plans, and all personal desires and dreams.